Hello everyone, welcome back to my channel. Disclaimer in the beginning. Always I would recommend you to go to that department, that particular branch that you're interested in, talk to your seniors, the consultants there, and then try to get the perspective. They can give you the best advice. It's not just talking to one person, it is talking to multiple people. And whatever information I give here, personally, I have been to the department, I've spoken to the people there, the consultants there, and after that, this is what information I have gathered and put here, compiled a bit because this is one such branch which is not that talked about, something that is so left unexplored. So here are some things that I would really like to give you some insights on. So let's get into it. How is this different from a radiology? Okay, so this mostly deals with radioactive substances for diagnosis and treatment for many cases, especially in the field of oncology, endocrine, cardio, nephro, GI, musculoskeletal, pediatric. Yes, there are numerous. Okay, I will tell you how each of the procedures will be used in the respective departments at the end of the video, because not many people are interested in taking this branch as such. So people who are interested, all the deets at the end of the video. So we will go on a brief description about what this branch is. So in sense, usually radiology is done outside the body. जो बाहर का beam होते हैं वहाँ, it's external totally. Whereas radiology is something internal, something you inject inside and then you do it. Secondly, nuclear medicine, it creates images using internal radiation, as I told you, the waves which generate inside the body. And, throughout the world, this branch has now established as a clinical discipline with its own charm and perks. And this is one of the hot picks because firstly, there are less number of seats, and secondly, because its clinical usage and therapeutic intervention is getting much popular. Okay, we will discuss about the perks a little later. And then, how is this different from radiology? Medical professionals, they prefer radiology because you get immediate scans and then there are a wide number of radiology seats, whereas nuclear medicine does take a little time to get the final output of the images that you've desired. Also, that means it's regarding the duration. And then diagnostic agents, usually we only use like mild contrast and radiology scans if and when needed, while nuclear medicine department does use some radioactive isotopes, as I told you. Okay, next, coming to the job profile, it is similar to RD. It is a normally 9 to 5 job or totally a desk job. You want to work in something like a software company, morning aa jao, evening chile jao, and sitting in front of the computers, no patient touch, not too much. That is radiology. Whereas in nuclear medicine, there is a little bit of clinical touch, where there is a separate field called therapeutic nuclear medicine. That is where you get to interact in close relation with the patients. You do have a few beds dedicated just for the department. There's a little bit of an advantage on that side. And secondly, the pay scale, it is similar to RD, and mostly RD even you have in a tier 2 cities, but nuclear medicine is just in the tier 1 cities because the instruments are so expensive. They have to be attached to a hospital. It is not possible that you set up your own, but there are people who did that in collaboration with private clinics, and many people who have interest in taking radiology as a branch, they did approach their consultants. This is a personal view where a few consultants told the people who were interested in RD to choose nuclear medicine over RD because it is an emerging branch and there is a great demand, and the pay scale is actually on a better side. The lifestyle is also very good because RD is also becoming saturated these days. So people are getting into interventional radio diagnosis. That is how it is going. But there is one con which I would like to highlight, where it is difficult to go abroad because nuclear medicine is considered still as a super specialty abroad, unlike RD. So it is quite difficult that. So what do you have to look for in a hospital? Okay, you need to see if there are enough number of PET CT scans with 16 slice. The more the number of slices, the better. Okay, a 16 slice at least. And the number of gamma camera scans that are going in the department, and whether there is a whole body dot or knock PET scan, and whether they have a medical cyclotron, because not every hospital has been equipped with all of these instruments. Whether they have a radioiodine therapy ward, I'll tell you in detail next. Whether which this radioiodine therapy can be used in the treatment of cancer patients with CA thyroid with radioactive iodine. And yeah, so see, not many hospitals do a therapeutic part of nuclear medicine, wherein you treat the cases such as radioiodine therapy for thyroid cancer, for thyrotoxicosis, for bone pain palliation using samarium or strontium, MIBG therapy, and other FDG and PET tracers. 3D implant brachytherapy, conventional and virtual stimulation. There are certain therapeutic part of nuclear medicine. Not every hospital does, because I know that in the American Cancer Hospital we do some part of a therapeutic nuclear medicine, and the career growth is very good because there is exclusive DM therapeutic nuclear medicine in many AIMS institutes. This is something that I got to know recently. And yeah, cutoff ranks. I will actually post an image of cutoff ranks because it is easier to see than me saying you. Okay, now we come to the part of yeah, it's the end of the video. So if you think you got enough information, you can just leave. If you want to know what exactly and how exactly we are applying nuclear medicine in each and every department, so here it is. In GI part of the nuclear medicine, we do get H. pylori infections, which is one of the most common which is one of the most common causes for adenocarcinoma stomach. Okay, so the urea breath test, C14 urea breath test for H. pylori to evaluate any GI absorption disorders. That is where we use, and I'm just highlighting on the important ones. Okay, and in nephro cases, we do evaluate the renal function tests. I think I'll actually ping this document in the comment section below so that you can have a better clarity of whatever PDF that I've made. Okay, in the neuro part, to interpret cerebral perfusion studies using SPECT, and also for the classification of dementias and suspected CSF leaks using scintigraphic studies. Also in musculoskeletal disorders, bone pains, bone tumors, and AVNs. Quite a lot, isn't it? Yeah, for nuclear medicine. Yes, there is so much to learn. So that's it for the video. So just let me know, because this is something that I really wanted to take it up, but then I couldn't. So I'm sure that this would give insights for people who don't have a better clarity of whether to take nuclear medicine or not. I don't know if I gave you enough information, but if there are any questions, just let me know in the comment section below so that I can ask my consultants and give you better information. Bye.